What is a mutation? It's a technical term for a sequence change in DNA. So DNA is the blueprint for all of the cells in our body. And the blueprint of DNA is made of chemical bases A, C, G, and T. And the blueprint is literally spelled out for our body using those 4 chemical-based letters. And we know what we expect a normal spelling to be for that blueprint. A mutation is really any change in those 4 chemical letters. We use the term mutation to have a negative connotation, right? A mutation may damage a gene, or a mutation may provide a negative outcome. But it technically means any change from those 4 chemical letters in the DNA. We know that research says about 10% of all cases of cancer are what's called hereditary in nature. And that means that someone inherits a gene mutation from either their mother or their father that predisposes them to some increased level of cancer risk. Cancer does tend to run in families, and families share the same environments, they share the same kinds of lifestyles, but we also know that they share the same genes. And genetic testing can now really definitively diagnose whether cancer is hereditary in nature versus just sporadically occurring due to lifestyle or environmental factors or from aging. There are certain red flags we would look for in someone's family history, which would include multiple cases of the same kind of cancer, younger ages of onset than we would usually expect, and a higher occurrence of more rare cancers than we would expect. Having a genetic test provides a definitive diagnosis of that increased risk for cancer. And it empowers people with their healthcare providers to take the necessary reactions to that increased risk. Things like increasing screening to try to detect cancer early, to measures that prevent cancer from occurring in the first place. We also know that with genetic testing, in any one family, some members inherit that mutation and other family members do not. So only with a genetic test could someone that has a family history of cancer really know that their risk is not increased if there's a mutation in the family that they did not inherit. The test is really a blood sample or a saliva sample that is then sent to us here at Myriad Genetic Laboratories. It takes us 14 days or less to do our hereditary cancer syndrome genetic testing, and then the results are reported back to the healthcare provider, and then the healthcare provider would have a discussion with the patient about what those results were and what course of medical action may be taken. The good news is that genetic testing for hereditary cancer syndromes is a covered benefit by most insurance companies. Every insurance plan is different, and we have an assistance program that helps patients look at what their covered benefits are and how much money they will have to pay out of pocket. But in our experience, most patients who are appropriate for testing pay $0 out of pocket for the genetic test.